Pricing transparency in healthcare reform. Many Americans don't know exactly how their healthcare providers come up with prices. According to a recent report by nonprofit Catalyst for Payment Reform, this is the fault of the providers themselves, who are rarely transparent with their pricing methods. They recently gave 45 U.S. states a failing grade for neglecting to provide a way for patients to understand their expenses. If patients had access to data like this, the argument goes, they would be able to properly budget for care down the line. As it stands now, they are victims of prices as care is needed. What this failing grade means is this: if you live there, you cannot readily find healthcare prices. With healthcare reform, more of the cost of care is shouldered by patients, which makes meaningful price information more important than ever. In the same way that consumers need to understand pricing of any product they buy, they need to know what healthcare will cost them. Particularly since we can expect healthcare to be one of life's biggest expenses as we age. What's standing in the way are confidentiality agreements by insurers, doctors, and hospitals. Price negotiations are kept behind closed doors and intentionally kept secret. What results is that consumers won't have data to be able to choose care providers. One reason this data would be important is that the same procedure could have different prices from hospital to hospital, or from doctor to doctor, with no difference in quality. Sometimes the amount a consumer's insurance company will pay can vary too, based on a number of factors currently not available to the public. Larger hospitals or hospital systems have greater leverage to get higher reimbursement prices from insurers. That extra money is paid by employers and consumers with higher premiums and deductibles. There has been a recent wave of legislators bringing prices for such care to the public through laws requiring transparency. Information repositories, also known as all-payer claims databases, are being constructed, providing accurate and complete information about pricing by hospital and physician. As of now, such public databases are only in Colorado, Maine, Massachusetts, Vermont, and Virginia. Florida is an interesting case as they've built a database, but still received a failing grade. Their site is managed by the Agency for Healthcare Administration and has been deemed to contain too narrow a scope of information, as well as being a clunky site. What information is present is not well displayed or very helpful. Florida's legislators are also not seeking transparency from insurers, which is a necessary piece of the transparency puzzle. Without this information, consumers only know how much the care costs total, not how much they can expect to spend out of their own pocket. Pricing transparency in healthcare reform.